am just gonna walk over some of the things that I have learned as an applicant, and now when I interact with our students like who are applying for residencies, or when we see them interview and all that. So those are some of the pits and falls that I'm going to talk about. And then the other things that I've noticed is the interview techniques, because I think that was one of the things that I was struggling as well, like when I was applying for residencies. And I think that's something that IMGs do struggle with most of the time. But before doing that, I just want to get an idea. I think I told Ms. Shifa to do a poll of how many people are like, what specialties are they applying into? So if
so at the bottom of your screens, you should be able to see the 2 poll questions. The first is what specialty you're interested in, and then if you're applying this year for the first time. And Dr. Abbas, can you also see the poll?
Yeah,
result?
I can see the poll, yes. Thank you. Do we have the results, or does it take some time?
I have like 22 people that have participated, so I'm just going to give another couple minutes for.
And also, how much time I have, Shifa?
We have you done for half an hour.
Half an hour, okay.
And then if you're done early, we can take some questions directly to you. Okay,
and it's going to be around 3:50-ish or so. Okay.
Yes.
Okay. Should be good. Thank you.
Okay, I'm going to end the poll in just maybe 10 more seconds. So if anybody else wants to participate, please do. Perfect. And I'm going to share results. Can you see my results?
Yeah, I can see the results. Yeah.
Okay, so here's the first one.
About 65% applying into IM, and then we got 13 in peds, 9 in psych. Well, that makes me heartbroken. I'm just kidding. Not many in surgery, and others was in, I think I saw some neurology as well. Okay. And first time 83%. Okay. Okay, well, that gives me a good idea. So thank you for that, everybody who did that. I think there was and neurology. Okay. So I think when I was applying to residencies, initially we all apply into and that's a fact, and I think everybody knows that. And I think some of my seniors would actually agree to that as well, that we all apply into every field, basically, because the goal is to get into a residency, and then sort of people excel into it afterwards. So initially that's what I did as well. I went to the big threes, which with me was internal, family, and psychiatry. And psychiatry initially was a backup for me. So, and it was mostly because I did not get good clinical experience when I was doing my rotations. I'm a Caribbean medical graduate, by the way, and I did my undergrad from Canada. So even that, I did not have a good experience, clinical experience, so I was not very sure about it. And also the other thing that comes in the mind is a lot of times psychiatry is associated with a lot of stigma, and a lot of people are not able to let go of their stethoscope. So that's a big thing, like especially in our community, which I have seen so far. So it took me like at least like, and that's how Dr. Siptan was saying as well, that you have to really build your CV towards psychiatry or basically any field. Like for me, like it took me about 2 years to build my CV specifically towards psychiatry. But I wrote exams for Canada and for the US. I had interviews even in medicine and family medicine in Canada and US. But even after the interview, I was dreading that I hope I don't get accepted into medicine. Not because I didn't like it, it's just that my interest was more built towards psychiatry. Uh, so that was my thing. But during my interview trail, I have seen a lot of when we interact with like when we're sitting in the group setting and this we were talking about things. I've seen a lot of aggressive approach, which I did mention to some of those in the past as well. So aggressive approach in terms of like coming out as their tone, which kind of sounds more desperate. So always keep your integrity. Don't, and that's gonna come out even now when we have the lunch with applicants. You can always tell that as well, and that's why I'm gonna stick with like towards my resident and applicant process rather than like because I think my seniors have already gone on and talked about like the rest of the stuff from the director perspective. But even as a resident, you can pick up some of the things. So a couple of things that you guys have to be careful. Even though they mention in the interviews or like interview trail that it's an informal interview, everybody is always monitoring you. So don't let your guard down in that sense. Uh, don't have any slip of tongue, which is gonna come out as offensive. I did had that once, like, and because we residents, we talk to each other about that stuff, and like because they do ask for our feedback afterwards as well. That how was your interview? Any kind of red flags? Even my program director, like when we go for interview, they before the interview season starts, they we have this meeting and then we talk about that. If you guys notice any red flags during the interactions with the applicants, do bring that up to us. So we do notice things and then we do report that. And why is that important? It's important because when you get matched and you're starting your class as your cohort and you literally rely on everybody, especially in your class, and the teamwork and collaborative approach is very important. Even right now, like we have a classic example is like the class or junior class, like there are a couple of people like who got into like a lot of they brush people the wrong way now, but obviously you can't find that out until you get matched sometimes. So be very careful during the interviews. Have your application reviewed by somebody, like any of those my seniors like who are here, like they can probably review your application, because sometimes people, even first-time applicants or repeat applicants, they have gaps. You want to put those gaps in a way that it would not only explain your gap, it would show your perseverance, your resilience. And this, like, I can tell you from my things, I had a 2-year gap in my medical school, and now, and it comes up even your fellowship interviews. Like, I'm applying for a child psychiatry fellowship right now, and they do ask about that. But it's the way you put those, it should come out as your strength rather than coming out as your weakness. And I think with regards to your specialty, just be honest in what you're applying into. Don't, there's going to be, I know there's people who are going to be applying into like multiple specialties, but just do your search. And like the previous seniors, how they were saying that try to justify, or like make sure, like if you're applying into different specialties, make sure you are able to justify your answers or justify your picks. Or if there's anything, like for instance for psychiatry, it's very easy to pick up, like if you have like 2 years of psychiatry resume, and then all of a sudden you end up doing some other random rotation, that would be a red flag in a sense that then you kind of like, it's not really a red flag, it's more like if you can justify it why you ended up doing it. For instance, you can put it in a word, you did it because you wanted to see psychiatry from a different lens. You could see it from a medicine perspective and see what kind of cases you see in there. So make sure about that, okay? uh, Personal statements, I think my seniors have discussed about that. What else? Let me, sorry, I got a message. Yes, the questions that are more hard to discuss would be, tell me about yourself, or tell me, another way of that question has been put up is, tell me something that's not on your CV. So make sure that kind of, a lot of times, like what I've seen is people are just basically repeating themselves, like basically repeating their CV, or they come in a way that it sounds like you've rehearsed that answer over and over again. So try to make points in your mind and try to connect those points while you're talking, when you're in the interview and when you're talking to anybody, because that's going to come out very important. Your interview skills, like your application, your scores, I agree with everybody that scores is the first thing that will get you the interview, but it's the way you perform on your interview is what's going to get you the residency, or what's going to get you matched. So make sure like you have those points in mind when you're talking about something, and keep an idea, or like look at the interviewer's face and see if they're getting bored from that answer. That would tell you like if the answer is too long, or is it the answer too small. And I think how Dr. Sukhan was saying, like make sure you're observant to other person, like, or like kind of pick up from their things, how they're talking about it, and then kind of go on from there. And start early. I think AAMC has a Residency Explorer program now. They started that. I think before, like when I was applying, like there was a match a resident program where you kind of enter in your scores, your year graduation. It kind of gives you like your custom list of programs. But I think now AAMC has created its own, which is Residency Explorer. I think a lot of US med students are applying, are using that. So use that. If you think you need it, do that one. Uh, Research, as everybody said, like research does count. Um, but then again, if you have like solid scores, and this especially goes to medicine residents. If you have like really solid scores, like I think at that time, to research would be like sort of like a icing on the cake kind of thing, you know. It's a good thing to have it. Another, I think another point that you guys need to keep in mind is, don't become too emotional on the interviews. That especially, I think like some of the, and this, I think this goes to like psychiatry applicants more, and I don't know, like if I'm not mistaken, I think family medicine uh, interviews do have a psychologist sitting in there as well. I don't know, I think maybe Dr. Joffrey can probably like correct me on that, but if I'm not mistaken, I think they have a psychologist sitting on there as well, and they can pick up like if you become so emotional to the point, like, because that's hard, that can come out as a little bit negative as well on your perspective, because you as a, think about it as a provider, because if somebody is coming and crying to you and then you become emotional, so how are you going to help if you yourself is getting that much involved in the patient? And that is very important for psychiatry as well. But overall, like, and also what's going to happen is it's a human tendency that when you become too emotional, you will let your guard down. Once you let your guard down, it's going to lead to, you're going to get into a lot of other problems of like kind of spilling out your weaknesses. That's going to go all against you. So I think those are some of the things that you guys need to keep in mind, and make sure that once your application is ready and submitted, then the next thing you guys should be doing is practicing on your interviewing skills. That's the key, because once application is submitted, you never know when are you going to get the interview, when are you not going to get the interview, but you should be ready for those questions. I think there's a book, it's called Successful Match for International Graduates. It has like a bunch of questions or so, which kind of I think Dr. Raza did mention that in his Q&A as well, that it's the question, is the way you answer those questions is what matters. You can be honest, but it's the way you put those questions, the wordings do matter as well. Other than that, I think this question came up before as well about the malignancy of the programs. Yes, some of the programs in Northeast can get, I would not say malignant, but I would say like, yes, some of the programs will make you work as well a lot. But at the end of the day, it's up to you to decide that you want to put that hard work or no, because residency is the stepping stone into the US for most of the physicians. Unless you want to go down the path of research, that's a different story. So it's for you to decide that how much effort can you put in, or how, from which lens are you looking at. Are you looking at it from a lens of being a overworked program, or are you just looking at it as an opportunity for you to put your foot in the US system? Residents overall, they are going to have some so I lost the train of thought. Residents are overworked anywhere, regardless of like whichever field you're going into, even in psychiatry as well. Doesn't matter. I think up till the first 3 years, you're going to be overworked. So it doesn't matter which field you're going into. I think there was a question that came up. But these are the advices that I have. I think it's better if I open the floor for questions right now, rather than like, and that's why like I don't, because I was not present for the whole presentation, but I know like most of my seniors have gone through a lot of these things. That's why I want to bring up some specific questions if anybody has questions. And also, sorry, before I open that up, people who are interested in applying into psychiatry, ACAP has a lot of resources. I mean, ACAP is American Academy of Child and Adolescent Psychiatry. They have, and I can put those in the on the chat as well. And I'm referring to like mentorship resources. Like I attend like ACAP meetings and like the MSR meetings, which is medical student resident meetings. And they have one thing or the other, they have so much going on like every time. Another good platform would be Buddy Space. That's typically on Twitter. You can follow them up. I don't know where I can write these things. Is there a chat group where I can put the links in?
Yes, there should be a chat. It might be at the bottom of your screen.
It only tells me Q&A. Oh, there we go. Oh, that's where the questions are. So, okay.
And then if you can just choose everyone, and then everybody will be able to.
So I think for psychiatry related things, I'm going to specifically put like a couple of resources which people don't know. Like there are, if you're interested specifically in child psychiatry, there are integrated residency programs as well, which you can apply to, which are combined programs. Buddy Space is like an overall journal idea about like residency and kind of like a residency platform and all that as well. So try to look into those things as well. I think there was a question about, do you have any psychiatry specific advice? So a psych specific advice. So psych specific advice would be in psychiatry, step 3, like as Dr. Siptan was saying, step 3 would matter tremendously, because what happened is like, and I have noticed that myself as well, that a lot of times, like after, because it is a specialty, so after your first year, if residents have not written their step 3, they're going to have problems, because then you get more into like psych specific things. So that's why for international graduates, I would highly recommend doing the step 3 before applying into psychiatry, or basically in the process of writing step 3 while they're going to be applying for psychiatry. That's going to matter a lot. Your personal statement is going to show a lot more, because, and that would be basically for any specialty. But with psychiatry, coming from an international medical graduate perspective, make sure it has a theme to it. Like for instance, my psychiatry personal statement was, I don't know where my statement is right now, but I think the main theme was about cultural stigma that surrounds the mental illness, and this was my base of my personal statement for it. Even for my fellowship, the theme that I have is cultural stigma, but it revolves around the intellectual disability and all that. So have that, and remember, when you're applying into psychiatry, psychiatrists are actually interviewing you. So that's another level of like, so make sure just basically don't BS, because they can pick up. I don't know if there's anything, if anybody has any specific question, like I know Obed asked this question, but anything's for psych versus what should be focused on. For psych, personal statement should be focused on skills that would make us a good fit, and why we think it's really good fit. I went with this story. That's what I did for mine, because then it's going to be hard for you to kind of put which skills are you going to put in and all that, and then you have to kind of give an example for every skill. For me, like this is what I tell the medical students and my mentees, to have your personal statement right in a chronological order of how your interest started, what led to it, what did you do for that to pursue that passion, any challenges that came in the middle. So it kind of becomes a timeline. So when somebody's reading it, it's more like a story when they're reading it. Now, I have I when I was attending this ACAP seminar, I think a couple of days ago, one of the program directors also talked about a personal statement, which was only half a page. But he was saying that even that half a page personal statement was so powerful in terms of the wordings that it did not need a full page. So it just depends on how you're putting it. But typically, like a one-page long personal statement would be sufficient, and try not to go more than a page. Now there are some programs, like for instance your dream programs, if you're applying into those, then do add a couple of things at the end that why do you specifically like this program. So this way, this kind of like a more personal touch towards them, that okay, this is the reason this guy wants to come to us.
Dr. Abbas, there are two hands raised if you want to take a
Oh yeah,
live question.
yeah. So I had the chat up as well. So
okay, so here's Sony. Sony, if you would like to unmute and ask your question, you could do that.
Yes, great. Good afternoon, respected panel. And Dr. Abbas, I can't believe everything that you're sharing. It's amazing. I'm a Caribbean student. I'm a Canadian going into child psychiatry, eventually wanting to pursue integrative pediatrics. So it's like you're a total mirror of what my dream career ultimately is. I have done a master's in education. I was a teacher before, and and then I took a gap, of course, because of COVID, and integrating, a whole mindfulness program for toddlers. So my question ideally is, despite having such vast experience, the letter of references, I don't have 3 to 4 LORs catered to psychiatry per se. I know you mentioned, or somebody had brought up a question of having an internist and relating it to psych. From a Canadian potential, like we have, residency teaching hospital like St. Mike's and Sick Kids and stuff in Toronto, as you know. Yeah. So providing an internist letter from there, would that be looked upon as being positive in a psychiatry aspect of that?
Yeah. So you can talk to your letter writer.
Yes.
And did you see any psych cases there?
To be honest, I was in the cardiology ward. I guess psychiatry is in every field, if you think about it, right? Like the mental and emotional stigmas, right. How the whole integrative family is required for the healing process, but nothing catered to children in my wards, unfortunately, because there were St. Mike's and Toronto General isn't pediatric specific, right?
Yeah. So I think that letter, right? Because sometimes what happens is like you can sort of make a twist and tell your writer to maybe like comment on it. This way you can put that in your
right.
In your work description as well when you're putting it in your application.
Right.
That you do see that. And this is what I did actually when I was working in Hamilton as a family when I was volunteering for like a family medicine clinic.
Yes.
That's what I put in as well, that I was seeing some psychiatric cases as well, like patients with depression. They were coming in first to the primary care and then they were going somewhere else.
And did you find for the psychiatry program, as a Canadian, even though you're an IMG, but coming from Canada, was that at all considered slightly positive, or was
it was slightly positive? Yeah, in that sense, a little bit. I guess like maybe from a visa issue, I didn't have the problem with visa issue because that was not an issue for me. My main thing that came up for me was like my step 1 was a little bit low compared to my step 2.
Okay.
So that kind of that was a big thing for me. And then I had like a couple of years of gap during my medical school.
Of course, yes.
So
Right.
those were a couple of things that, but if you're able to justify that
Yes.
by giving step 3, I think step 3 is what got me the residency. That's
Wow.
that's what I'm gonna, step 3 with like extensive psych experience, what got me to where I am.
And is there a contact? I guess we can ask Shifa, but if there's some kind of, just to reach out and get, if some questions come along during the residency.
Yeah. So I was gonna
Psychiatry.
do that, and thanks for reminding me. I was gonna put my email address in there. I just put it in the chat group. So if you guys have any questions about it, like just reach out to me. Any question that comes in your mind for like your interviewing skills or so,
Sure.
please reach out and ask. And anything specifically about psychiatry, I'll be happy to help you guys
Really
out.
appreciate it. And good luck to all the candidates. Thank you for providing this panel. And good luck to everyone. And hopefully we all reach our goal eventually. Thank you, Dr. Abbas, for taking time.
Thank you for your question, Sony. And if I can just ask, if there are any other people that want to ask questions of Dr. Abbas specifically, now is a good time.
I think Ramsa asked a question, can we apply and take step 3, for example, in December? Or do psychiatry program before this? No, as long as, so just make sure that it's done before it. Just when you go on your interview trail, just let them know that I am applying for, I am already in process of writing my step 3. I have the date and I should be done by it, like by the time they get matched. Yeah. Don't hold your application back because you're not, because of step 3. At least give it a shot. Yeah.
And then we have Obaid, if you want to unmute and ask your question as well.
Hey, Zargham, Dr. Abbas. Thank you so much for answering all the questions so far already. Really appreciate and I'm benefiting from your advice. So thank you for that. I was just wondering. So I'm a fourth year American DO medical student, and I'm applying for psychiatry this cycle. It's my first time applying, and I don't really want to do much other than psychiatry. But with like seeing how competitive psychiatry is getting and stuff, I was thinking whether it might be smart to have a couple of backups just in case, like like a backup specialty like IM or FM, and have that on the match list. Do you think that would be a smart idea or no? And would it negatively hurt my chances in psych, because that's my primary goal?
It's not going to necessarily hurt you in that sense. I mean, did you do any sub-Is?
Yeah, I've done one, and I have another one coming up.
Are they both in psychiatry?
Yeah, they're both in psychiatry, yeah.
Okay. Yeah, I don't think it's going to hurt you to apply into it, because you're not doing anything. You're still gaining your experience in psychiatry with doing sub-I, because that's going to really show that. Mm-hmm. But if you're just applying as a backup, and I know like when I spoke with a lot of DO students as well, like when they rotate with us,
yeah, I
think your school also tells that make sure you apply as a backup as family medicine. Is that correct?
They haven't told us that directly.
Okay. Yeah, one of the schools here, like in the area, like, so they were telling the advisors do apply that as a backup.
Yeah.
For family medicine or like internal medicine, whichever.
Yeah.
But I think overall, like, it's not going to hurt you unless you do something drastic. For instance, like do another sub-I in like a medicine, because then it kind of gets like confusing. But then you can back that up with applying to like family medicine and psychiatry programs, or like medicine or a med psych program, which are also like those do exist as well. Yeah. So you can always back it up, and you can always say that like I don't think it's going to hurt you, because since you're just a fresh graduate, I mean, you're still in medical school.
Yeah.
Just wanted to take a look at psychiatry from different angle.
Okay.
Yeah, you always want to have different lenses when you're looking at a psychiatric patient. So I don't think it's going to hurt you though.
Got it. And so like, do people generally ask in interviews, like, are you applying to anything else as well?
They're not supposed to ask you that question.
Okay, got it.
Yeah.
Okay. And then one last question that I had was, for submitting ERAS, September 29th is like the date that we should submit it by if we want it to be timestamped as the 29th. But I was wondering, like, is there benefit in submitting it earlier? And if so, like, how early?
So that I would submit like, and I'm going to give my fellowship example for
Mhm.
that, because I submitted my things like when all my things were ready.
Mhm.
I don't want to submit like an application when it's not ready, and then you go back and then you have to email everybody that, oh, this thing of mine got ready afterwards.
Mhm.
So, oh,
Yeah.
here you go, take it and all that.
Got it.
I would just have, well, once you have everything ready, then I would that's what I would recommend. Yeah, unless you have a pending publication that's gonna get done like what in on maybe October 20th, you'll find out then,
Mhm.
which in one way it's a good thing that you do have that publication, so then you can reach out to the program, to your dream program,
Yeah.
and say here that, so I just wanted to let you know that this was a pending publication, and it just got published, so I just wanted to share that with you, and just send that as a PDF. So that would be a good thing,
Yeah.
because then they will show the interest, and then it kind of like the you're reaching out and all that. But
Mhm.
also I would recommend like completing your application before doing that.
Got it. So like, don't be in a rush to submit it before it's.
Don't be in a rush. Try to get everything done. Try to get everything done before the deadline. I think it's September 29th. Yeah.
Yeah.
And make sure you're after, like, especially for US uh, letter writers,
Mhm.
most of them are really busy.
Yeah.
You
Yeah.
have to make sure, like, at least give yourself 8 weeks of time before. Don't go at the end.
Yeah.
When
Yeah.
I'm doing like student evaluations, like they send me evaluation, like it takes me like 3-4 months to get back to them, because you just get busy with clinical work, and that's
Yeah.
with attending this even more difficult, because they have a lot more stuff, things going on. So make sure you let them know ahead of time. And another thing you should also ask them is like, can you please make me a strong letter of recommendation?
Mhm.
Don't just say that, make a letter of recommendation, because even saying that word strong
Yeah.
would actually make a difference.
Got it.
Yeah.
Okay.